Hi, it's Dr. Lauren here. We are going to talk about something that unfortunately many of you may have experienced in the past, and that is miscarriage. A miscarriage is the loss of a pregnancy before 23 weeks of pregnancy, but the majority happen within the first 12 weeks of pregnancy. Some common symptoms when you're experiencing a miscarriage is to get vaginal bleeding, cramping and abdominal pain. But sometimes there may be no symptoms at all, and it may be only when you go to get a scan that that you can realise there's a problem. Now that said, light vaginal bleeding is actually quite common in the first trimester, so the first part of pregnancy. So if you are pregnant and you get a little bit of vaginal bleeding, that does not at all mean that you have or are going to miscarry. So miscarriage is really, really common. A quarter of women will experience or have experienced a miscarriage, and it's thought that even up to 1 in 4 pregnancies end in miscarriage. So many of those will be known about, but some will obviously be lost even before a woman may have been aware that she was pregnant. So it may just be that a period comes a little bit later and is a lot heavier than usual, and it's a very, very early miscarriage. Recurrent miscarriage, so that is when a lady has 3 or more miscarriages in a row, happens to about 1 in 100 women. So what causes a miscarriage? So there are many reasons, but most often you won't ever know the cause of your particular miscarriage. For the most part, it's normally because of abnormal chromosomes. So chromosomes are the genetic building blocks that make up our DNA, and having too few or too less of those is the most common cause for a miscarriage to occur. And for most people, most ladies, it will be a one-off event. It's really important to remember that the vast majority, the overwhelming majority of times, a miscarriage cannot be prevented. It is not something that you have done that has caused it. There are a few things you can do to decrease the risk, like not smoking, drinking less, not taking drugs, being a healthy weight. But for the most part, it is absolutely nothing that you have done that has caused miscarriage. So when you miscarry, it may just be something that happens of its own accord and comes to an end. Sometimes you may need to have a procedure just in case any of the products, it's a horrible word, but that's what's called the products of conception, are left behind in the uterus. Bollocks. A miscarriage is emotionally and physically draining. It is completely normal to have feelings of guilt, of shame, of anger. No one can tell you how it is appropriate for you to feel or what you should do. You should do what you feel comfortable and what you find comfort in. There are counsellors and charities that specialise in providing advice and support to people who've undergone a miscarriage, and your midwifery team, if you were under one, should be able to point you in that direction. Otherwise, they're readily available online. You may find it helpful to have a memorial or some sort of memorandum from the pregnancy. But again, that's your choice as to how you want to navigate how you are feeling. Turning to supporting other people, so wives, girlfriends, sisters, aunts, etc., who have undergone a miscarriage. Please remember that loss is loss, and the number of weeks that somebody was pregnant does not correlate with the size of their loss. I think it's a really important thing to say that don't avoid the topic. If you're talking to someone, it's not something you can fix. No one's expecting you to fix it. But if you at least acknowledge it, you don't have to say anything specific other than just, I'm sorry, I'm here, I'm thinking of you, I don't even know what to say, but I'm here if you want to talk. Just something general like that. But just trying to completely avoid the topic and not say anything at all is not generally constructive. Most women who've undergone a miscarriage would say. Please avoid saying things like, well, everything happens for a reason, it was probably for the best, or at least you already have a child, or at least you can get pregnant, because these statements are not particularly helpful. And please also remember, don't neglect the father or partner in this situation, because they are grieving too. As far as trying again after a miscarriage, you can do that as soon as you feel physically and emotionally ready. There is no rule. As soon as you feel ready to do so. And please remember that the vast majority of people will go on to have a healthy pregnancy after a miscarriage. Look after yourselves.